Join Denise Marsh. Amp Media Production presents Gypsy Soul, your one-stop shop for letting out your inner gypsy. Join Denise Marsh as she brings on a variety of guests to share their artistic vision with the world.
Welcome back to another episode of Gypsy Soul. I missed you guys so much last week. I hope that you had a wonderful Thanksgiving. And I hope that you did not feel like a gypsy running around trying to cook your turkey. No. I was lucky enough to go out with my best friend, and we had someone else cook for us. But I hope whatever you did, that you had a great time. And in light of gratitude, I just wanted to say that I am so grateful for my guests that are here today. They are my main sponsor. They're very special people. And I have Max Cohn here and Jen Cohn here. They're the owners of Maxhealth Chiropractic. And they are going to help us and teach us more about how to feel better and how to deal with some high-level therapies that can actually speed up the pain and process of recovery. And actually, Jen is going to be part of this project today because Jen is actually feeling some pain, and Max is going to help her and actually demonstrate it on here. So you guys get a whole show today. You get a bones on, hands on, everything kind of feeling for this type of therapy. And I look forward to you being able to watch it and get some good ideas from it. So we will be going to a short commercial break, and then we'll hear more from Max and Jen, but hang tight and bring a notebook because you might be taking some notes. Sit back and relax, and we will see you in just a few minutes.
Maxhealth Chiropractic, located in the heart of Wellington, Florida, is the area's premier chiropractic office. Dr. Max Cohen and our highly skilled team want to be your natural healthcare provider. Everyone should be able to move, work, and play at their best, regardless of age. We offer a wide range of advanced chiropractic techniques and therapies to eliminate pain, enhance performance, and improve mobility and function. Set your appointment with Maxhealth Chiropractic today. Maxhealth Chiropractic.
Okay, welcome back to Gypsy Soul. So hi, good to see you guys.
Hi,
We just
Denise.
saw you on the commercial. Now we get more. So the last time that you were on the show, Dr. Max, you talked to us about the importance of chiropractic adjustment. And before we get to that, because we definitely will, we have another special guest here, and I would like you to introduce her.
Well, this is Jen. Oh, sorry, can you hear me now? This is Jen, my wife. She's also the owner, part owner of Maxhealth Chiropractic, and she's been my partner in crime for at least 20 years now.
At least.
At least. And yeah, this is Jen.
Yeah. Thank you. Thank you for having me.
What do you do at the office, Jen?
Oh,
What do
well,
you do to make it look good?
What do I not do? No, we've started our business about 10 years ago, and he asked me, do you want to be part of this? And I said, absolutely, I do. So after working in a lot of other industries, I really wanted to focus on this and really be a partner with my husband in running our business because, it's so important to make sure that our patients get 5-star quality service at any point in time, that everything is run smoothly. So he can really focus on treating patients and making sure that our patients are getting the best care. He doesn't need to worry about credit card processing and computer glitches and making
plays
sure
different
that
roles.
Yeah,
Yeah.
the
She
bills are
greases the
paid and
gears,
stuff.
makes
so-
sure everything
Yeah,
moves.
it's like a well-oiled machine.
Thank
literally.
you. Yeah,
Yeah.
I just want to make sure that everything is really smooth sailing behind the scenes, so he can be the best doctor possible.
And together, you two make it work.
Aw,
Yeah.
thank
And
you.
you've been
And we have a lot
successful.
of fun with it.
I couldn't do it without her, and I'm
I
not
could
just
tell.
saying that.
And you're a good comedy routine, too.
Yeah, we are, right?
So speaking of comedy, I wanted to share something funny with you. So I went to Dr. Max recently because I was having sciatica problems, and I was having problems with my lower back and legs. And sometimes when I laid down on the table, I get twisted like a pretzel, literally, to help me. It helps me. But I get scared sometimes that I'm going to fall off the table. And so Dr. Max, I love what Dr. Max says. Every time I think in fall off the table, he goes, if you fall off the table, you will get a free trip to Maui. And I have not been to Maui yet because it never happened.
You're not going to fall.
So I haven't fallen yet, and I don't think I ever will. So Maui will have to be another time.
Yeah.
But I feel so much better from last time. Like, I have not had that sciatica pain come back.
Well, it's an honor to help you.
And Dr. Max was telling me how the brain is controlling everything else in the body.
Correct. Yep.
Right?
Everything.
And because I don't always understand all the technical terms, but you definitely do, of course. And you could explain to them maybe more of what that meant when you said that?
Yeah, I mean, as a chiropractor, the main thing that we're looking for is movement. You know, better movement, not only just in the spine itself, but how your spine communicates to all your muscles and all the other joints in your body, your arms, your legs, and things like that. And so restoring movement is really essential, and what we talked about last time is that movement neurology and how it can recharge the body and how it can make you move better. And
Like a reset, right?
Yeah, reset, and that's what we do. And I'm hoping
Well,
to
you
demonstrate
definitely
that.
reset me because I feel great.
Awesome.
And I always do after I leave the office.
Yeah.
As I think a lot of the testimonies show that other people do as well. So Dr. Max and Jen, you guys have a lot of good things to show us today,
Yeah,
right?
yeah.
So
We're excited.
Can we get started with some of that stuff?
Yeah, yeah.
Good, because I know that Jen said that you said you're having some pain, right, Jen?
Yeah. I mean, the daily life happens. You know, it's so important to get adjusted. I know for me, it's ever since I even was introduced to chiropractic when we first started dating, because his dad's a chiropractor.
It's a good story.
It is a good story. I had no idea about that, and I swear by it, you know. And so being a mom of two and running a business, and you know, in my younger years, being an athlete and just being very busy and just you have to get adjusted. It's so important. So daily life catches up with you. Wear and tear catches up with you, and wear and tear caught up with me. So today I was feeling it. I was feeling it in the low back and in my foot a little bit. So we're going to talk about that and work on that today.
Wonderful. I look forward to that.
Yeah.
Did you want to show us some of your tools, Dr. Max?
Yeah,
Before we do
yeah,
hand adjustment?
Sure thing. I can go ahead and demonstrate that. I'll hold that for 1 second. So I'm going to reach behind me. All right, and I'm just going to demonstrate, just show you guys some tools that we use. These are called Grafton blades. Myofascial, this helps with breaking up scar tissue and myofascial release. Sometimes when joints are restricted, there's, you know, fibrotic adhesions that occur. So we want to break up as many adhesions as we can to provide better mobility.
It looks a little scary.
They look scary, I know. It
feel like
looks
I'm
like
watching like
looks
a
like something you
horror
see out of a
movie.
Dexter or something, right? But
Make us feel safe.
these are stainless steel, and you can hold it. It feels
Yeah.
pretty heavy, but they're
Oh,
not
it is
sharp, right?
heavy. Looks like a banana.
It's called the boomerang. Yeah.
Is it going to go back on my face?
That won't.
Very dangerous.
It's just shaped like one. These are called the handlebars. This is my
like a bike.
favorite. Yeah.
Yeah.
Those are for larger surface areas like the IT band. I treat a lot of runners' knees with that. The bigger, larger primary mover muscles like your lats, your quads, your glutes, those are really good tools to help release adhesions
Does
in
it
those
sit
areas.
There? Like I'm holding now, but like.
I'll show
where-
you.
Yeah.
Yeah.
what I'm
So
curious
you
about.
mean like how I use it?
Yeah. How do you use it?
Okay. Well,
That
actually,
it's not dangerous.
I'll show you on Miss Jen in just a
Yes,
second.
I would like that.
Yeah.
Thank you.
And then something else I have. Let's see. I have one of my favorite tools here. I'll show you this. This is called an arthro stem. You probably can't hear me because I don't have the mic right here. This is called an arthro
It's a
stem.
jackhammer.
It is kind of like a jackhammer, you know, and it goes back and forth
Oh, wow.
like that.
I think you used that on me before. I remember hearing that.
Of course, I've used this on you.
Yeah.
But
It's all coming together.
I don't think you've seen it though because you're usually face down.
Right.
You know?
Okay. Now I know what's happening.
Yeah. So this helps with the muscles and helping increase joint range of motion. It doesn't hurt. It feels so good.
It does.
It looks rough. Like watch. Look how rough this looks. Right? But it actually feels really good.
It looks like it's beating you up.
it is,
But
right? It's
yeah.
kind of percussive.
But it does feel good.
Yeah.
And now I know I can match the instrument to the
Exactly.
So in our office, we have hands, we have tools, and we have technology. And obviously, my hands always come with me, hopefully. They never leave. We also have these tools that I'm showing you here, and we also have technology. Technology that we have that I couldn't bring with me are things like laser. We have
Maybe next time.
Maybe next time.
Yeah.
We do have a class 4 laser that helps with blood flow, helps stimulate healing properties and inflammation, helps treat acute injuries. We also have extra corporeal shockwave therapy, which helps break up scar tissue, more for those chronic type pain syndromes that, are never going
atrophy?
away. Atrophy is a different syndrome that we can also treat and condition as well. But for scar tissue that limits motion, all right, that's something that can be now treatable with shockwave therapy. And for patients that have conditions involving the disc, all right, which is many times
Your back? It's
yeah,
your back?
many
Okay.
times can be treated naturally, and we see that occur, in our office and with our physical therapists in our local community. We can help work with that. But for some folks, surgery is inevitable, and they've tried everything. But with our technology, with the disc decompression therapy, over 88% of the cases that need surgery don't need surgery
That's
after 8
wonderful.
weeks. So yeah, we're excited
Not
about
at all,
that.
right? Not in the long term.
Yeah, and every single case that we've had, none of them have needed surgery.
And
so.
I'm assuming they, like I do, like I come back from maintenance. Like I don't come
Yeah.
every week, but just like
No.
a car needs
Maintenance,
like
right.
that,
Mhm.
So that alleviates you having to come all the time, but then that still keeps your body the way it needs to be in alignment.
Exactly.
So I'm getting very excited,
Yeah.
excuse me, about this adjustment, because I don't think a lot of people do this on their show. This is going to be a real live adjustment.
And I don't even
So-
know exactly how I'm going to treat her. I'm going to look at her and evaluate her with you. And it gives you a chance to ask some questions along the way.
I would love that.
Yeah.
So I think we're going to go to a very short commercial break so we can set up, and then we can do this adjustment. For our
Awesome.
audience.
Sounds like fun.
Okay,
Great.
Oh,
we'll see you in a little while.
Maxhealth Chiropractic, located in the heart of Wellington, Florida, is the area's premier chiropractic office. Dr. Max Cohen and our highly skilled team want to be your natural health care provider. Everyone should be able to move, work, and play at their best, regardless of age. We offer a wide range of advanced chiropractic techniques and therapies to eliminate pain, enhance performance, and improve mobility and function. Set your appointment with Maxhealth Chiropractic today. Maxhealth Chiropractic, located in the heart of Wellington, Florida, is the area's premier chiropractic office. Dr. Max Cohen and our highly skilled team want to be your natural health care provider. Everyone should be able to move, work, and play at their best, regardless of age. We offer a wide range of advanced chiropractic techniques and therapies to eliminate pain, enhance performance, and improve mobility and function. Set your appointment with Maxhealth Chiropractic today.
Okay, we're just setting up here, folks, so give us a minute. Some excitement happening back here. Okay, so I think we're all ready to start, right?
Yeah,
So
well,
Dr. Max, you're going to evaluate
Yeah.
Miss Jen right now?
Yep. Okay, so Jen was actually having some issues. She was explaining to me on the car ride here, when we were thinking about, okay, what are we going to talk about today? But yeah, she was having some lower back issues. In fact, she complained this morning about her right foot, and she was telling me that it feels like it's weak. It doesn't feel like she has full, what'd you say, strength in the foot?
Strength in the foot, yeah. It just feels like very weak. When I'm going to go up on my toes, it just feels like the leg wants to collapse
I
down.
had that yesterday. I had the same thing after I was driving. I had that.
Yeah, and it's just, I was like, I knew something was off, and I almost felt it kind of traveling, like kind of up the leg a little bit. So I was
Yeah.
like, I knew something was off. So that's what's
So
going
Dr.
on.
Max,
Yeah,
you're
so-
right
Here
here.
he is.
Yeah, I mean, I have x-rays on Jen. There was no accidents, injuries, or traumas or anything like that. So understanding her history, knowing her spine very well, I'm just going to go ahead and do a brief evaluation, and I'm going to treat her according to what we see here today. All
Okay,
right?
so let the examination.
Yeah. So go ahead and stand up. I'm just going to show just general range of motion, global range of motion. Turn face this way. Go ahead and bring your feet together and just reach down to your toes. Yeah, go as far as you can. And I'm just looking down here. And straight. Can you raise your arms up overhead and look up at the ceiling as high as you can? Now arch back, bridge back as far as you can. Drive your hips forward. Any pain with that going this way? All right, good. Go ahead and place your hands on your hips. Let's see if there's any issues with this. Turn your head to the right. Let's bring your feet together. And then twist to the right. Over here. Go this way. Any pain with that? Okay, good. Now turn your head to the left. Whoa,
Pretty
don't fall.
thorough.
And twist this way. I can see that you don't twist to the left as far as you do the right. And what do you notice with that?
Just not as easy to twist to this direction.
More restricted?
Yeah.
Okay. Now go ahead and have a seat. All right. Now what I'm going to do is I'm going to see if the problem is actually in her hip. Is it the spine, or is there something else going on, maybe in the leg? So go ahead and just bring this leg back and rotate your leg this way. All right. You should see 50 degrees. That looks really good. Go this way for me. That should be 40 degrees, and that looks really good. So go here. Go here this way. Any pain with this?
No.
Right? There was no pain when standing up. But I do notice that you don't have as much external rotation here on this side. And what side was the hit? The foot dropping on the right side. Now go this way for me. And that looks more than normal.
Yeah.
So there's a little imbalance on that left side. So maybe there's a compensation on the right. Go ahead and lay on your back face up.
Okay.
All right. So now what I'm going to do is I'm going to take a look at just a little bit more range of motion in her hip. And I'm seeing that she has pretty good extension through here. All right. Now I'm going to have you do some resistance. Okay. Can you hold it for me, Denise? Thank you. Go ahead and push out for me. Good. Right there. Go push out, hold. Right there. Just harder. Come on. All right, so clearly the right side is pretty weak there. Now go ahead and push out the left. Harder. Go, go, go. That side feels a lot different. All right, which side feels stronger? The left side feels definitely stronger. But there was also more restriction in this side, right? Okay, now go ahead and bend the knee and bring your foot up, turn your foot in, push your foot right here into my hand. I'm going to continue looking down. And what's going on here is that the nerves that originate actually in the spine travel down through the leg and control certain muscles. And if there's any nerve root dysfunction in those areas, the connection to the muscle will be slower. The communication will be weaker, and it won't produce the same function as the other side. And that's what's happening here to this. So go ahead and sit up, Jen. All right, now I'm going to go ahead and motion palpate your spine at this level. Okay, now I'm going to really break out how her spine is moving at that segmental level. And here with Jen, she has a little bit more of a curve here, as you can see. Go ahead and tilt to the left. Good. And right there's some pain, right, Jen? Yeah, there's some pain. And also her left paraspinal muscle right here, it turns off. It doesn't hold the same way as the other side. Go ahead and tilt to the right. Is there pain there? No pain going to the right. And actually that muscle on the right side stayed strong. It held really well. It stayed active. So what's going on here is her spine there's some weakness in there, all right, some nerve interference, and actually a motion restriction causing her spine to pull almost more to the right. So I'm going to go ahead and make a correction to that. And let me have you on your tummy, face down. So Jen and I, we have 2 kids, and I always joke, I say tummy for all of our patients. Okay, go ahead and keep your legs straight. I'm going to come around this way.
We're getting a workout today, all of us.
I know. Raise your right leg straight up as high as you can. Okay, lower down. Try the left side up as high as you can. Did you feel a difference there, Jen? Which side was easier? The left side was easier, so the right side was harder. Okay, so we see that she doesn't have as much extension through the right hip. There was also more weakness, nerve interference, lack of motor control going on that right side. So what I'm going to do is I'm going to make an adjustment through here, okay? I'm going to use my hands. I'll use another instrument, okay? And I'll use a technique called ART, or active release therapy, to release her hip flexors really briefly so she has less strain on her lower back and it doesn't curve so much. I would also give her some home exercises too that you would have to do. All right. So let's go ahead and get started. Okay. All right. So do you want to take a break?
No. I wouldn't.
All right. Go ahead. Okay. Lay on your side. Turn face me. All right. So here we go. We're going to go ahead and get started. I'm being
She's
told
getting
that
comfortable over
I
there.
don't have a lot of time. In the
I'm
office.
not going to fall off the table.
Oh, remember.
No
you
trip
get
to
go
Maui.
Maui.
All right. So as you can tell, there was a lot of extension through this lower back. So I have her bottom leg bent so we can generate a little bit more flexion and just a little push here. Really easy. Breathe in and breathe out.
No cracking sound.
There it goes. That was it. Go lay on your back, face up. Good. Good, just like that. Now go ahead and bend your knee. Bring your foot up. Turn your foot in. Push against me here. Hold. Good. Push your leg out. Hold. Very nice. How'd that feel?
Strong.
Turn face down. Okay, now go ahead and raise your right leg straight up. Did you see how much higher that lifted? Lower that down. Try this side up. Fantastic. How'd that feel?
Easy.
All right, awesome.
Looked easy too.
Yeah,
Her
now,
range of motion looked easy.
No, I won't lie. I know what a lot of her listings are and things like that. But yeah, this happens routinely in our office. That's why you felt better.
I did.
Yeah.
And you didn't have to use that
Little
that
activator.
the activator.
Oh, it's right here in my
thing.
pocket.
I
Yep.
remember.
Yeah, I use this instrument for patients that maybe have bone softening disease or a condition, or maybe they prefer not to be adjusted manually, where you hear that cracking sound.
Right.
Yeah.
And you ask them first, right?
Of course,
You know,
yeah,
is it
yeah.
okay if I do it this way or that way?
Oh, yeah, yeah.
Someone might not like that touch, or someone
Yeah.
might like a harder touch. Yeah.
Absolutely.
So how do you? Jen's falling asleep. Jen, wake up.
Come on, wake up. No trip to Hawaii for you.
Okay. So
Well, yeah.
before we say our goodbyes, I know that that you, Dr. Max, you have some special things to tell us about the holidays. For
Yeah.
the for
Oh,
the
yeah.
practice.
Okay, so tomorrow, actually, we're celebrating our Patient Appreciation Day. We do this annually to help raise money for Kids Cancer Foundation. And what we've done was we've lowered the cost of our adjustment. What's the cost of our adjustment for tomorrow?
It's only $30, and so a must cut in half. And it's not a fee that we collect. It goes 100% to Kids Cancer Foundation. So it just goes into an escrow account that the following week we write a check to them for all of that. So basically, our two doctors are donating their time for the day to give back to Kids Cancer Foundation, because we just absolutely love them.
beautiful.
Yeah.
But it's also a party. So I mean, we have food and we have
I really want to come. I have to stay at school late tomorrow, but maybe
we have some fun stuff. You can always stop by. So there probably is a couple open appointments.
And there's a raffle, I think.
There's a raffle. We're raffling off something really, really cool. So everybody.
Trip to Hawaii? To Maui?
Up close.
Oh,
No, actually, it's going to be something that can help you facilitate some manual therapy at home. It's called a Hypervolt, and it's really nice, and it comes with all the attachments and the carrying case, and that can be something that helps get you through your between your different adjustments to help break up all that scar
You gotta
tissue.
come
no.
by
Get to
tomorrow.
keep it?
Yeah, it's a raffle prize that you could win.
Might have to bring that to school and
There you
show
go.
and
There you
tell.
go. There you go.
Kids would love that.
They would.
I don't- It might not be right in the curriculum, but it would be fun. Well, I just wanted to say that I'm so excited and so happy that you guys are my main sponsor, and you just mean everything to me. I mean, in so many ways, especially being able to come to you for adjustments
Yeah.
and feeling better mentally and physically. And I know more people will want to come hearing your story, Miss Jen.
Yeah.
And, listening to how you two work together. And you seem to work very well together in many ways.
Thank you.
So
Thank
I'm very
you.
grateful.
Well,
for
we're
that.
very grateful too for you and for letting us share our story here. So it's been a lot of fun, and we love that. We love sharing this with people. So thanks for the platform in order to do
And
that.
I think a lot more people will feel more comfortable with the art of chiropractic after they hear
Well,
these
that's-
and be less scared.
Well, that's the whole thing. We want you to feel comfortable. We want people to feel comfortable. We answer your questions. We'll show you beforehand what it's like, and we never do anything you don't want.
And speaking of comfortable, I wanted to let you guys know that I'm very comfortable with the fact that next week there will actually be another Gypsy Soul show. So I will be on next week, but I will be on at 5:30 instead of 5 o'clock for another very special guest. And I hope that whatever you're doing, you're letting your inner Gypsy be, because he or she wants to come out. They want to feel free, they want to have fun, and they want to really thrive, not just live. So with that, I wanted to let you know to have a great rest of your week. And I'm looking forward to seeing you again next week, but at the regular time, 5:30. So you guys have a great night and keep it going with your Gypsy Soul.
Thank you for tuning in to Gypsy Soul. Make sure to stop by next time for another enlightening show. A show that was produced by Ant Media Productions and hosted by Denise Marsh.